The first one, I've read the virus does not like heat. Does that mean there will be a spike in our winter because it will spread more easily?
Well, there's a lot of controversy about this. I do not think we can bank on this at all. The biggest issue, the overwhelming issue, is we have a community which is not immune to this. So any reliance on that is just completely something we should not consider at all. So at this moment in time, nobody's banking on it. We've just got to apply all the sort of measures that we have to do at the moment and not rely on the possibility that that will save us.
Can I pass COVID-19 onto my pet, in particular my dog, asks one viewer.
Okay, I've talked about uncertainty, but there's a couple of dogs that found residual COVID-19 in Hong Kong. But the strong advice at the moment is that there's no possibility of either a pet contracting it or transmitting it to somebody else. So please, do not abandon your pets. We need them as much as possible at the moment in our time of self-isolation. So please do not abandon your pets. We need them more than ever. Oh.
Yeah, all right. So pets still up on the lap while people are perhaps watching more TV than usual. One person wants to know about the new pinprick tests that can possibly give a very quick result on whether someone has the virus. Is this a breakthrough that's going to help us keep a track of things?
Zero use at the moment. They sound like a good idea, but all they do is actually pick up whether you become immune to it after maybe a couple of weeks or so. We're at the phase at the moment, we need to know whether the swab test in the nose will actually pick up whether you've got an infection right now. So a test that tells us whether you've had it 2 weeks ago, we don't even know how good they are, is pointless at the moment and may give somebody false reassurance that they don't have the infection. So at the moment, in fact, we're in South Australia, we're thinking about whether we need to ban the things because people may rely on them unnecessarily. So zero use at this phase of the illness.
Will they be more useful down the track if we want to, get an idea for herd immunity and how many people have had it? And if people are saying, I might have had it a few months ago, I'm not sure, rather than clogging up the system, they get this test showing they have had it before?
That's exactly right. That's where may come into it. But at the moment, with people being confused about, even the criteria for testing, they really will add a confusing element, which is absolutely pointless at the moment. So really, just ignore any talk about that at the moment. The authorities will start to tell you when they're going to become useful, but not now.
One viewer notes a very small number of young children have been shown to be infected so far. Is this because not many are infected, or is there a bit of an underlier here because not many young children are actually being tested and perhaps they're not symptomatic?
Yeah, it's hard to know. It's hard to know whether it's actually a matter of they just don't get sick and therefore they're not getting tested at the moment. There's still a lot unknown about this, and I think overall lack of knowledge about it is of concern in this area. But the flip side of that is it does appear overall that, particularly with the schools issue, that they don't appear to be a major source of transmission and cause of spread to community. So that is why, generally the thought has been ideally to try and keep the schools open to as late as possible.
Chris, also someone wanting to know, we keep getting told not to wear face masks in public because it won't protect us. Why do healthcare workers wear them then?
The big difference is that healthcare workers are going into a high-risk environment of actually being exposed to COVID, whereas if you're walking around outside, social distancing, the physical distance of trying to avoid the distance you get spat on or using good hygiene will actually help you avoid it. And what you're doing out in the community is burning up the sort of using the very protective equipment that the frontliners are going to have to use when they really need it. So at the moment, really don't burn that up for us. We will need it as healthcare workers. There may come another time, but this is not the period, because we've got to use our resources wisely, and that is not a wise use of resources in the overall context.
We speak to Dr. Chris Moore every Tuesday and Thursday. Get in your questions, #COVID questions, or to our Your Say email. Chris, thanks for your time as ever.